Welcome to the Physiology Game Show. Tonight's theme is pneumonia. Tonight on the show we have contenders. Please introduce yourselves.
Elana.
I'm Dominique.
Germain.
Awesome. Let's get started. I'm going to ask each of the contenders, or all of the contenders at the same time, some different questions about pneumonia, and hopefully they can answer them for quite a sum of money. Topic number 1, diagnosis. Many of you young people want to be doctors and nurses, so I would hope you know how to diagnose patients with their ailments. For 400 points, would someone please explain the diagnosis of pneumonia?
I got this one.
Elena.
So your doctor will listen to your lungs with a stethoscope. If you have pneumonia, your lungs will make a crackling, bubbling, and rumbling sounds when you inhale. You also may have wheezing, and it may be hard to hear some sounds of breathing in some areas of your chest. Your doctor will most likely order a chest x-ray if he thinks you have pneumonia, and some patients may need other tests, including a CBC blood test, CT or CAT scan of the chest, sputum test, pleural fluid culture, or pulse oximetry to measure how much oxygen is moving from your bloodstream, done so by attaching a small clip to your finger for a brief time.
Awesome, she got it right. 400 points for Elena. Okay, topic number 2, signs and symptoms. It's important as healthcare professionals and as people just watching out for our own health to know the big road signs that tell us to go to the doctor. For 300 points, please list all of the signs and symptoms of pneumonia. Wow, none of you guys can guess it? I'm shocked. Well, let me tell you so that you can keep yourself healthy. Some of the major symptoms of pneumonia is a big cough, where you might be coughing up green or yellow mucus. Gross. Sometimes it's even bloody. You might have a fever, shaking chills, or shortness of breath. Sometimes when you have, maybe if your grandma or grandpa has pneumonia, they might be confused because that happens in older people. You might have excessive sweating and clammy skin, headaches, loss of appetite, or even some sharp stabbing pains in your chest. So if you're feeling any of these things, including abnormal breathing sounds, go ahead and go to your doctor. Okay, topic number 3, management and treatment. Once we notice that we are sick and then we're diagnosed by the doctor, it's important that we do exactly what the doctor instructs so that we can get healthy again. For 400 points, someone please outline the treatment of pneumonia and how to manage it as a patient.
I've got it. So for general treatment, it's important to drink lots of fluids to help loosen secretions and bring up phlegm. It's important to get lots of rest and control your fever with aspirin, non-steroidal anti-inflammatory drugs, or acetaminophen. For bacterial pneumonia, it's important to take your full course of antibiotics. These antibiotics are typically oral macrolide, such as azithromycin. Antibiotics will depend on age, severity, and symptoms, and if your symptoms don't improve within a couple days, you might need to go to the hospital to get a culture and sensitivity test. Additionally, if you're aged 65 or older, have heart problems or lung problems, can't keep your fluids down, or have worsening symptoms, you may need to go to the hospital. For viral pneumonia, doctors may prescribe antiviral medications such as Tamiflu or Relenza. Additionally, for both bacterial and viral pneumonia, giving the patient oxygen to increase their oxygen in the bloodstream and medications for chest pains may be helpful.
Very good. Okay, last topic. Germain, it's your time to hop in if you know it. Topic number 4, the physiology related to what we've learned. All right, most importantly, as this is a physiology show, we need to know about the physiology of the disease. How can we know how to treat something if we don't know how it works? So for another 400 points, will our contenders please outline the physiology of pneumonia?
I know this one.
Awesome!
So microorganisms, which could be a bacteria, virus, or a fungi, invades the alveoli, and that causes an immune response, which causes white blood cells to diffuse across the bloodstream into the alveoli, and that they attack the foreign invader. And then this immune response also causes the membrane to increase its permeability. This increase in permeability allows fluids and red blood cells to diffuse across into the alveoli, which poses a problem because it increases the amount of space that the gases must diffuse across in order to reach the bloodstream, or the gases in the bloodstream to go into the alveoli. So this causes the alveoli to become dead space, since there's little or no gas exchange. So therefore, the blood returning to the left side of the heart contains a higher concentration of carbon dioxide and a lower concentration of oxygen than it would if the lungs were healthy.
Very good. Wow, you guys are all equaled up at this point. So one more question to see who wins it. For 800 points, who is the best professor ever?
Who is Dr. Flynn?
Woo! Wow, you guys are great. And since all of you are so awesome, we're going to give you each $1 million. Congrats! Thanks for joining us, folks. We'll be back next week with COPD.